This episode is brought to you by... Oops, I've got a box of Cheez-It crackers staring at me and I just wanted that irresistible cheesy crunch. Sorry, that was a total snacksident. What was I supposed to be talking about? So salty, so crunchy, so cheesy. Whoops, lost my train of thought. I've heard of brain freeze, but brain cheese? I'll just have one more Cheez-It cracker and then I'll get back to it.
A message from McAfee.
I'd say howdy, but I'm not a real cowboy.
And I'm not a real alien.
We're deep fakes, and because of fakes like us,
It's hard to tell what's real.
unless you have McAfee. McAfee's scam detector automatically identifies text and email scams.
And even deepfake.
And it works everywhere, even out on the range.
But you're not even a real cowboy.
If they're faking it, they're not making it past us. Get award-winning scam detection today. McAfee.com/keepitreal.
This is Dr. Ted O'Connell with the Med Prep to Go Step 2 Qbank podcast. Today we'll be reviewing 3 primary care questions. Just a reminder that you can find these questions and many more at medprep2go.com. If you have feedback or you'd like to get involved in contributing to this free online and audio Qbank, please email me at ted.medprep2go@gmail.com. If you like what we're doing, please give us a review, subscribe to the podcast, and consider letting your friends know about this project. All right, let's get started with the first question. A 23-year-old woman presents to her primary care physician for complaints of irregular menstruation. She states she has had 6 menstrual periods during the past 12 months. Prior to last year, her menstrual cycles occurred every 28 to 30 days, lasted for 4 to 5 days, and had moderate flow. Menarche was at age 13 years. Past medical history is otherwise negative. The only medication she is currently taking is a daily multivitamin. She does not smoke cigarettes or drink alcohol and currently works as a graduate student. Vital signs are within normal limits except for a body mass index, BMI, of 30 kilograms per square meter. Physical examination reveals small hairs on the patient's upper lip and chin and several small, less than 1 millimeter comedones scattered around her forehead. A complete blood count and chemistry panel are within normal limits. Urine pregnancy test is negative. Which of the following is required to establish the most likely diagnosis in this patient? A, detailed family history. B, no further testing is indicated. C, pelvic ultrasound. D, serum fasting blood glucose level, or E, serum testosterone level? The correct answer is B, no further testing is indicated. The Rotterdam criteria, established in 2003, are widely used for diagnosing polycystic ovary syndrome, or PCOS. These criteria require the presence of at least 2 out of 3 key features. 1, evidence of oligo-ovulation, defined as infrequent menstrual cycles and typically characterized by menstrual cycles longer than 35 days, or anovulation, defined as the absence of menstrual periods and in the context of PCOS. This refers to secondary amenorrhea. Criteria 2, clinical and/or biochemical signs of hyperandrogenism. Clinical signs include hirsutism, acne, or male pattern baldness. Biochemical signs include elevated serum androgen levels, such as testosterone or androstenedione. Feature 3, polycystic ovaries on ultrasound. This is defined as having at least 1 ovary with an ovarian volume greater than 10 milliliters and or 12 or more follicles measuring 2 to 9 millimeters in diameter. The patient in this vignette has met 2 of 3 of the Rotterdam criteria since she has oligo-ovulation, that is 6 menstrual cycles in the last year with prior normal cycle length, and she has clinical signs of hirsutism. hair on the upper lip and chin, as well as acne. No further testing is needed to make the diagnosis. Treatment consists of conservative and lifestyle approaches, such as diet and exercise, and also pharmacotherapy, such as combined oral contraceptive pills, metformin for underlying insulin resistance, thought to be at the core of the pathophysiology, anti-androgens, and clomiphene citrate and letrozole for infertility. Answer choice A, detailed family history, is incorrect. While PCOS does demonstrate a strong hereditary component, a detailed family history is not considered necessary to diagnose PCOS. Answer choice C, pelvic ultrasound, is incorrect. While a pelvic ultrasound could demonstrate polycystic ovaries, this woman already satisfies the Rotterdam criteria, so a pelvic ultrasound is not necessary for diagnosis. Answer choice D, serum fasting blood glucose level, is incorrect. While serum fasting blood glucose may be elevated due to the underlying insulin resistance found in many patients with PCOS, this is not part of the diagnostic criteria. While this value may be helpful to determine if anti-diabetic agents are indicated for this patient, it is not necessary for diagnosis. Answer choice E, serum testosterone level, is incorrect. While serum testosterone is usually elevated in a patient with PCOS, this woman already has clinical signs of hyperandrogenism. Thus, biochemical signs are not necessary for diagnosis. The key learning point here, the Rotterdam criteria are considered the gold standard for the diagnosis of PCOS. They require 2 of 3 of the following to make a diagnosis. 1, oligo or anovulation. 2, clinical or biochemical signs of hyperandrogenism. And 3, polycystic ovaries on ultrasound. Question 2. A 25-year-old woman presents to the clinic for irregular menstrual cycles with reduced bleeding for the last 2 years. She also endorses excessive growth of facial hair for 6 months. She has a history of prediabetes and was advised lifestyle modification, including a controlled diet and regular exercise. She does not have any other medical conditions and does not take any medications. She does not smoke cigarettes and drinks alcohol socially. She is 5 feet 2 inches tall, 158 centimeters, and weighs 176 pounds, 80 kilograms, and her body mass index is 32.2 kilograms per square meter. Vital signs are within normal limits. Physical examination reveals an obese female with evidence of coarse hair growth on her face. She is counseled about her condition and referred for imaging. Upon hearing her probable diagnosis, she is concerned it may increase her risk of cancer. Which of the following is the most appropriate response by the physician? A, an increase in the risk of endometrial cancer is associated with her probable diagnosis. B, her BMI combined with prediabetes increases her risk of pancreatic cancer. C, no increased risk of cancer is associated with her probable diagnosis. D, there is an increased risk of all gynecological cancers, including vulvar, vaginal, cervical, uterine, and ovarian cancer. Or E, there is an increased risk of breast cancer, but it can be mitigated by taking progesterone-only pills. The correct answer is A. An increase in the risk of endometrial cancer is associated with her probable diagnosis. This patient, presenting with irregular menstrual cycles and oligomenorrhea, along with virilization manifested as facial hair growth, has polycystic ovary syndrome, or PCOS. She also has prediabetes, hyperinsulinemia, and obesity, features commonly found in patients with PCOS. Due to unopposed estrogen exposure, the risk of endometrial cancer is higher in women with PCOS than in women without PCOS. Answer choice B, her BMI combined with prediabetes increases her risk of pancreatic cancer, is incorrect. PCOS does not increase the risk of pancreatic cancer. Answer choice C, no increased risk of cancer is associated with her probable diagnosis, is incorrect. PCOS is associated with an increased risk of endometrial cancer. Answer choice D, there is an increased risk of all gynecological cancers, including vulvar, vaginal, cervical, uterine, and ovarian cancer, is incorrect. There is no association found between PCOS and these cancers mentioned. Answer choice E, there is an increased risk of breast cancer, but it can be mitigated by taking progesterone-only pills, is incorrect. It is unclear what effect PCOS has on breast cancer, as it is associated with factors that both increase and decrease the risk. However, progesterone-only pills slightly increase the risk of breast cancer even in healthy women. The key learning point here, due to unopposed action of estrogens, patients with PCOS have an increased risk of endometrial carcinoma.
The Lincoln Wishlist sales event is happening now. Here's what's on everyone's wish list. Enjoying holiday jingles with brilliant 3D audio that surrounds you? Check. Watching snow flurries through the panoramic Vista roof? Check. Packing up presents with the spacious Lincoln Splitgate? Check. Everything you want. All standard on the 2025 Lincoln Navigator SUV. Visit your local Lincoln retailer or learn more at Lincoln.com for exceptional offers on 2025 Lincoln vehicles today.
Meet the computer you can talk to. With Copilot on Windows, working, creating, and collaborating is as easy as talking. Got writer's block? Share your screen with Copilot Vision to help spark inspiration, and use Copilot Voice to have a conversation and brainstorm ideas. Or maybe you need some tech help. With Copilot Vision, Copilot sees what you see. Let Copilot talk you through step-by-step guidance so you can master new apps, games, and skills faster. Try now at windows.com/Copilot.
Question 3. A 28-year-old man presents to his primary care physician with intermittent episodes of severe numbness and tingling in the fingers of both hands, accompanied by a pale appearance of the skin over the last several months. These episodes are sometimes followed by pain in the fingertips. He has no known medical conditions and does not take any medications. He does not drink alcohol, but occasionally smokes cigarettes. His diet consists mostly of fast food, and he volunteers that it is because he has been under a lot of stress and has been trying cognitive behavioral therapy. He works in construction and roofing. Vital signs are within normal limits. Physical examination reveals normal appearing hands with intact sensation, strength, and distal pulses. His recent lab work done as part of an annual examination include complete blood count, comprehensive metabolic panel, lipid panel, and hemoglobin A1C that were within normal limits. He was prescribed vitamin D supplements. Which of the following is not associated with an increased risk of the most likely diagnosis? A, exposure to cold weather. B, frequent emotional stress. C, male sex. D, occupational exposure to various solvents. E, occupational exposure to vibration. Or F, smoking cigarettes. The correct answer is C, male sex. This patient likely has Raynaud phenomenon, which is characterized by recurrent vasospasm of the fingers or toes due to triggers such as cold temperature and stress. The extremities may become pale, cyanotic, or erythematous during the episodes and may be accompanied by numbness, pain, and/or tingling. There is symmetric bilateral involvement. These episodes are self-limited. It is more common in women than men. Answer choice A, exposure to cold weather, is incorrect. Episodes caused by exposure to cold temperature are the most common feature in Raynaud phenomenon. Answer choice B, frequent emotional stress, is incorrect. Emotional stress has been identified as a trigger for episodes of Raynaud phenomenon. Answer choice D, occupational exposure to various solvents, is incorrect. Various solvents, such as arsenic and polyvinyl chloride, can predispose to Raynaud phenomenon. This form of the disease is known as secondary Raynaud phenomenon. Answer choice E, occupational exposure to vibration, is incorrect. Occupational exposure to vibration can cause secondary Raynaud phenomenon. It is most commonly seen in patients around 35 to 40 years of age due to prolonged exposure to power tools and other forms of vibration. Answer choice F, smoking cigarettes, is incorrect. Cigarette smoking is associated with Raynaud phenomenon. Nicotine also causes vasoconstriction and can worsen the condition. The key learning point here: Raynaud phenomenon is a vasospastic condition characterized by pale extremities after exposure to cold weather or emotional stress. It affects women more often than men. Okay, that's it for this episode, but please do check out our other episodes as well as all of our content available online at medprep2go.com.